High blood pressure. The blood pressure is the pressure of the blood within the arteries. High blood pressure is the most common cardiovascular disease. It is also known as hypertension. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. Its measurement is recorded by two numbers, systolic pressure and diastolic pressure. Systolic pressure represents the pressure in the blood vessels when the heart contracts or beats. Normal reading 90 to 120 mm of mercury. Diastolic pressure represents the pressure in the vessels when the heart rests between beats. Normal reading 60 to 80 mm of mercury. Risk factors. Age. Both systolic blood pressure and diastolic blood pressure increase with age. Systolic blood pressure increases more than diastolic blood pressure due to decreased distensibility of arteries as their wall becomes increasingly more rigid. Sex. In females before menopause, systolic blood pressure is 4 to 5 mm of mercury less than that in males of same age. After menopause, systolic blood pressure is 4 to 5 mm of mercury more than males of same age. Obesity. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Family history. High blood pressure tends to run in families. Physically inactive. People who are inactive tend to have higher heart rates, as the higher your heart rate, the harder your heart must work with each contraction and the stronger the force on your arteries. Using tobacco. Smoking or chewing tobacco immediately raises your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Too much salt in your diet. Too much salt in your diet can cause your body to retain fluid, which increases blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Symptoms. There are usually no symptoms with elevated blood pressure. That's why it is sometimes referred to as a silent killer. Symptoms of high blood pressure may be present in those who have an extremely high blood pressure, such as severe headaches, fatigue, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, pounding in the chest, neck, or ears. Complications: heart attack, aneurysm, heart failure, weakened and narrowed blood vessels in your kidneys, thickened, narrowed, or turned blood vessels in the eyes, metabolic syndrome. Treatment: if elevated blood pressure levels are accompanied by diabetes, kidney disease, or cardiovascular disease, your doctor may suggest blood pressure medication as well as lifestyle changes. Losing weight if overweight or obese, eating a healthy low-salt diet, exercise regularly, limit alcohol consumption, quit smoking.